Hi, my name is Sona, Shah, and I'm CEO of Neopenda, one of the finalists in the Vodafone Wireless Innovation Project. Neopenda is a global health social enterprise that's really passionate about reducing newborn mortality in the developing world. There we go. An estimated 46 million newborns around the world are in need of care from complications that happen at or around birth. But unfortunately, not all of these babies are getting the care that they need. Actually, the WHO has said that 80% of newborn deaths are preventable with timely recognition of distress and appropriate treatment. Now, I'm not sure how many of you have been inside a neonatal intensive care unit in the US, but if you have, you must have noticed the thousands of dollars worth of monitoring equipment that every baby is hooked up to. You must have also noticed that there are a lot of nurses available to help care for these sick babies. But unfortunately, the story is not the same in low-resource settings like Uganda. Hospitals are severely lacking in staff and equipment. When my co-founder and I were in Uganda last year, we witnessed firsthand that a single nurse can be in charge of 20, 30, almost 50 babies all at the same time. And on top of that, there's no monitoring equipment to be able to quickly identify when these babies need her attention. So we started thinking about this issue about a year ago when we were graduate students at Columbia. And we started talking to a lot of physicians and nurses. And when we were in Uganda, we witnessed that while a nurse was taking care of a baby on one side of the room, babies in distress on the other side of the room frequently went unnoticed, and many of them died as a result. So we wanted to try to tackle this challenge, and we spoke to physicians and nurses both here in the US and in developing countries. And many of them told us that monitoring these 4 crucial vital signs would be a huge improvement to their workflow: respiratory rate, heart rate, blood oxygen saturation, and temperature. It's standard, it's monitored in the US, but in developing countries, there's no monitoring equipment available for them, mostly because it's far too expensive for them to purchase. So we thought, what if we could translate this really expensive monitoring equipment that already exists in the US, integrate all 4 of these into a much simpler and much more affordable design? And that's exactly what we've done. We've created a wearable vital signs monitor for newborns that's integrated into a really small device. The wearables wirelessly communicate with a single tablet, so multiple newborns can be seen on just one screen, so a nurse can efficiently be able to tell the health status of all of the babies in the room just from that single screen. We've been able to develop a novel sensor array that's more appropriately designed for developing countries. It's much more affordable, it's lower in power, and it's rugged, so it can withstand any of the conditions in the hospital settings. In addition to this novel technology, we also believe in creating a very comprehensive solution. Working in developing countries is very different than in the US. The technology itself is very important, but almost more important is understanding how to integrate that well into the community. Having an appropriate design is extremely important to us, and we believe in human-centered design, where we're focusing on working with our clinician partners and our nurses on the ground in Uganda to make sure our design is appropriate for their needs. This goes hand in hand with having a standalone system. We recognize that it's really important to be able to work within the hospital infrastructure. But every hospital in the developing world is extremely different. They're limited in different resources. Many of them don't have stable power supplies. Many of them are limited in wireless networks. So we've been able to integrate all of our solution into a standalone system. It's ready out of the box, so a nurse can just take it out of the box and use it as soon as she gets it. This enables us to have a really scalable solution. While we're starting small in pilot hospitals in Uganda later this year, we plan to expand to other countries in need, other hospitals in need across the world. As a for-profit social enterprise, we strongly believe in having financial sustainability long-term in addition to a high social impact of reducing newborn mortality. We're working on developing key strategic partners in addition to getting expertise like yours to ensure that we have the highest impact possible. So with that, we invite you to join us in the fight to reduce newborn mortality. Thank you very much.